si no esperamos hasta el final.
Ok. Connection.
All right, everybody, how we doing? We are live, and it's Hump Day with Dr. Alex Earl. So this is the time that I get to spend with you guys and go over some very important plastic surgery topics, and of course answer all of your questions. Okay, so we're here at Pure Plastic Surgery today, and today I'm going to talk probably one of the most important kind of subjects that I like to discuss. So I kind of do this about once a year. Because it's so important, and of course we're continuously getting new followers, new platforms. Today we're on YouTube, we're on TikTok, we're on Instagram. So this is really kind of one of the most important talks that I can give. So I hope everyone pays attention. And of course, if you can't be here for the entire talk, remember that we always post this to our YouTube channel. So you go to YouTube at Pure Plastic Surgery, and you'll be able to see the entire talk then as well. Okay, but what are we going to talk about today? We're going to talk about how to choose your plastic surgeon, okay? How to choose your plastic surgeon. So very important. And a lot of times, patients will have the idea, they're like, I want to do something to better myself. I want to feel better about myself. I want to kind of take control of my body. And I want to do, for example, a BBL. Great, so now what do? Where do I start? Okay, how do I choose the right surgeon for me? And then that's where the research phase comes in. And fortunately today, a lot of this can be done online. So, obviously a few years ago, 15 years ago, it was a lot tougher. At that point in time, you just kind of had to see like who was around your neighborhood. You would ask your friends, neighbors, you would ask people, and it would be a lot of like mouth-to-mouth type of referrals, okay? But today, a lot of this information is on the internet, okay? And including even the background of the surgeon, whether they've had any misdemeanors, any felonies, any other issues like that, their certification, whether they've ever been sued. All this information you can find on the internet. Okay, so today I'm just going to kind of break it up for you. There are no particular order. I think pretty much all of these are very important. And if your surgeon can check off all the boxes, then that is definitely, you should put that surgeon then on your short list. And then after that, it's probably just about meeting the surgeon and personality and things like that. Okay, so the first thing you can start looking into is education. Okay, so you want to see where was the surgeon educated, where did they do their training. Okay, so training and education, of course, are similar, but it's two different things. So in order to become, say for example, a plastic surgeon, of course, you have to start with college, right? So you start with college, and then after that, you have to go to medical school. After medical school, then you have to do your residency, which you can either do in general surgery or directly into plastic surgery. Eventually, even if you do general surgery, then you got to do a plastic surgery residency as well, okay? And that's pretty much the entirety of your education and your training, all right? So you want to make sure they're going to reputable places, right? Places that have a good reputation for educating and training the surgeons well, where they already start to gain a lot of experience in all these procedures. All right. So for example, me, I'm Ivy League educated, so I went to Princeton for undergrad, one of the top universities here in the U.S. And then I went to NYU for medical school, like once again, one of the top medical schools here in the U.S. And then I started doing my general surgery training. I did that here in Miami at the University of Miami, Jackson Memorial Hospital. Did that for 5 years. Then went off and did 2 years of NIH funded trauma research. And then did 3 additional years of training at Duke University, so the Duke University Plastic Surgery Program, widely considered one of the best, training programs here in the U.S. All right, so definitely check out their education and training. That's something that you'll be able to look up on the internet. Okay. Next, you should start looking at their board certification. Okay, and what's important here is that they are certified by the American Board of Plastic Surgery. Okay, this is really the most important board that you have to look at, and you can look that up also on the internet. So if you go and you Google American Board of Plastic Surgery, you can go then to the website. There's going to be a little ticker there that's for the public, and there you can enter the surgeon's name, and then they're going to tell you whether they're board certified, yes or no, and whether their board certification is active. Okay. Now the key here though is that you got to make sure that you put in the right name. For example, for me, I know I go by Dr. Alex Earl, but my first name is actually Stephen, right? So you got to search out Stephen Alexander Earl, my complete name, and then you'll see my board certification there. Okay. So that is the most important board in terms of, when we're talking about cosmetic or plastic surgery, all right? And it is a board that is approved by what's called the ABMS, so the American Board of Medical Specialties. So it's a true board, all right? And so that's the one that you have to look up when you're looking up your surgeon, okay? I myself, I'm double board certified, which means that I have the American Board of Plastic Surgery and the American Board of Surgery as well. That's why it's a double board certification. I have 2 board certifications, okay? After that, you want to go into the experience, right? So you want to go into a surgeon who has a lot of experience specifically in the procedure that you're looking for, okay? So for example, if you're thinking about BBL, then I have a ton of experience with BBL, right? I've done about 3,000 or probably more than 3,000 BBLs in total. And more specifically, I've done over, close to 2,000 ultrasound guided BBLs. So if you're looking for someone that does ultrasound guided BBLs for extra safety, there's very few surgeons that are using the ultrasound, and I've probably done the most ultrasound guided BBLs here in the US, all right? But say for example, you are looking for rhinoplasty, okay? So rhinoplasty is not a procedure that I do. I mostly, dedicate myself to the body. So, in that case, then I wouldn't be the surgeon that you're looking for, okay? So if you have to do anything with like breast, tummy tuck, liposuction, BBL, mommy makeovers, arm lift, body work, certainly, pure plastic surgery, Dr. Alex Earl has a ton of experience with all those procedures, okay? But if you're doing something like rhinoplasty, for example, I did a bunch of them back in the day, but it's not what I'm dedicating myself to now, all right? So it does make a difference what the experience is. You want to make sure that experience is in the procedure that you're looking to get done, okay? So now that you know that they're well educated, they're well trained, they're board certified, and they're experienced in the procedure that you're looking for, the next thing is the style, all right? Because different surgeons have different styles. So for example, I was never someone to do like these really, really huge vixen looks, right? And it turns out, I was a little bit ahead of the curve because today, that's not what most people are looking for. Most people want these enhanced natural results, maybe like a soft vixen look, but you want to make sure that the BBL fits the patient's foundation, right? And that all the transitions are nice and smooth. So that's my style. One of my favorite shapes is the upside down heart, right? That's one of the shapes that I'm known for. So the upside down heart shape from the back. So that's part of my style there as well. So an hourglass figure from the front, upside down heart shape from the back. Very minimal incisions done safely on the ultrasound guidance. That's what we call our South Beach butt lift, which is our signature BBL that we have here at Pure, the So BBL. Okay. So in order to determine their style, you want to look at a lot of their before and afters. And I'm going to tell you something here right now. If most of the before and afters are on table, that's not good, okay? You can make anything look good on the table, all right? But that's not what's important. What's important is what does it look like at 3 months, 6 months, 1 year, 2 year, okay? So if you're going to a site and all they have is on-table results, I would be like a little worried about that, okay? So you want to look at long-term results, all right? You want to look at long-term results, at least 3 months out. 3 months, 6 months, a year, okay? So that's very important when you're looking at those before and afters, okay? Now, where can you go to look at before and afters? Of course, you can go to the website, but also you can go to Instagram. You should be able to go to social media, so TikTok, Instagram, okay, YouTube, and then you should look at the surgeon's own Instagram, and then sometimes you can look at what other patients are saying and posting out there. So, for example, Facebook groups. So we have a great Facebook group. It's called Earl's Pearls Community, Dr. Alex Earl Facebook group. You should definitely join that group, and you can interact with other past patients, past, present, and future patients. And you can also search the group for a ton of photos, beautiful, beautiful before and afters in that group, okay? So I highly recommend that. So you should go to Instagram, you should go to Facebook, of course the website, many different places where you can look at before and afters coming from the surgeon themselves and from patients, in the past as well. Okay? All right, so now that you've they're kind of knowing your style, the next thing you should look at, which is super important, of course, is safety, okay? Patient safety needs to come first. You gotta go to a surgeon or facility where that's the number one priority, okay? And you can't just go to somewhere where they're just kind of talking the talk and there's no proof that they care about patient safety, okay? So here at Pure Plastic Surgery, of course, we don't just talk the talk, we walk the walk, for example, and this will come over, for the next one here. Our OR is certified by the Joint Commission, what's called JACO, okay? The highest level of certification that an office-based OR can have, okay? And in order to get that certification, you gotta go through many extra steps. And you got, in order to be able to reach that level of certification. So there are multiple levels. The kind of baseline level is certification by the Florida Department of Health. That's like the bare minimum you need to be able to operate. If you have that, then you're operating illegally. That's kind of like basement surgery. You don't want that at all. All right. So you want to check the certification. You at the very least has to be certified by the Florida Department of Health. The next step up is something called Quad ASF. And then the next step up, and it's part of the top of the line, the final step is the Joint Commission, which we call JACO. And that's what we have here at Pure. Okay? What else demonstrates that we're walking the walk and not talking the talk? Our complication rates. Our complication rates are extremely low. They're lower than the national average. And I give a live every December as we wrap up the year, talking about all our stats, specifically for the BBL. I talk all about the BBL stats and our complication rates, reoperation rates, etc., and they're all extremely low and much lower than the national average, okay? So that's something you definitely want to be looking into. You want to make sure that your surgeon is focused on patient safety as their number one priority, okay? All right, we already talked a little bit, the surgeon is great. You want to make sure that the surgeon is great. But it doesn't stop there. You need to make sure that where they're operating on you is a certified facility and that the facility is also all about safety as well, okay? And a way to check that is to check their certification. So if they're JACO certified, that means they've gone the extra step, okay? But the very least, it has to be certified by the Florida Department of Health. If they don't have that, do not go. That is basement surgery, okay? That is dangerous, all right? Okay. All right, so we got to make sure the facility is certified. We're looking at the complication rates. All right, you want rates such as infection to be low. All right, infection rates should be low. The rates of like DVTs and blood clots should be low. Okay, you certainly don't want anyone where they're having a lot of fat embolus. That's a no-no. You shouldn't go to a place that has that. Okay. And so just overall, you want scarring to be minimal. That's tougher to control, right? Because of genetics and things like that. There's a lot of patients that are more prone to hypertrophic or keloid scars. So it's a little bit tougher to control, not fully on the surgeon there. But overall, you just want to make sure that the complication rates to the surgeon and the facility are low, lower than the national average if possible. Okay? All right. Next is how accessible is the surgeon, okay? I've heard of places where you go and you don't meet the surgeon until literally 10 minutes before surgery, and then you never see them again. That is not good, okay? You need to go to a surgeon that is accessible. You want to be able to meet the surgeon at least a day before surgery, or if you're meeting them right before surgery, that they can dedicate 30, 40 minutes to you. Make sure that you get all your, you're able to express what you want out of the surgery, get all your questions answered. But it starts way before that. You're going to go to a facility where the team is, on top of everything you need, answering all your questions, okay? And then that the surgeon is accessible. You should should meet the surgeon at least a day before surgery, and then you see the surgeon after surgery as well, okay? You want to see the surgeon at least one more time, after surgery, and then have that surgeon be accessible when needed for like, if you're out of town on like YouTube, not YouTube, excuse me, like FaceTime or some sort of virtual way of communicating with that surgeon, okay? So you want accessible surgeons and excellent communication with the surgeon and their team, all right? Which brings me to the last one here. You want that surgeon to be backed up by an A+ team, all right? And that's what I can say here, like the Pure team is actually, fantastic, okay? We use this HIPAA compliant messaging system called Clara, and through there we're communicating all the time. We're answering all your questions. You can send us photos, we can send you photos, you can send videos, but pretty much it's basically constant communication throughout, certainly Monday through Friday, and then we have people that are on call, okay, during after hours. So at night and on weekends, we have someone that's on call 24/7. All right, you want that. You want to be able to communicate with the surgeon's team pretty much at any time that is absolutely needed. Okay, so for emergencies, then you will call the after hours line, which is at night and on weekends. Okay, but there's someone on call at all times. All right, super important. So you're looking into all these things, all right? And you want to make sure that the people that you choose, the people that get on your short list, are able to check out all these boxes, okay? So, for example, Dr. Alex Earl, right? Education, Princeton, NYU, training, University of Miami, Duke. Certainly, good job there. Board certification, double board certified, check. Experience, BBL, you want to do a BBL? Over 3,000, 2,000 with the ultrasound, check. More ultrasound guided BBLs than anywhere in the US. All right, that means that you're gonna be safe. Safety is your number one priority. I went the extra step to learn how to use the ultrasound. I use the ultrasound with all our BBL cases. Never had any fat embolism ever, okay? Patients first mentality, check. All right, style. Here's where, you like my style, you don't like my style. My style is nothing like too big. I don't do diaper booties. I don't do ant booties. Okay, I don't do super exaggerated vixen looks. Okay, I don't think those are long-term styles. Eventually, you're going to be coming back, and we've seen it now. People coming back to get their BBL reduced. Okay, and we're seeing more and more that nowadays. Like people have gotten BBLs elsewhere, even in other countries, Colombia, Dominican Republic, now coming back to get their BBL reduced. Okay, so I go for long-term, beautiful, aesthetically pleasing results. Okay, so a BBL that fits your frame, that fits your foundation, where all the contours are smooth. Okay, typically an upside-down heart shape from the back, but I can do other shapes as well. We can do more of a round shape if you'd like. We can do slope, anywhere from a slope to like a pokey slope or a slopey shelf. Those are other options that we can do as well. Okay, but look at the style and look at the before and afters. You can check out my before and afters on Instagram. You can check it out on the Pure Instagram. You can check it out on our website. You can go to our Facebook group and get it from the patients themselves. You don't have to take it from me. All right, but many beautiful before and afters. All right, so I think that's definitely a check there. Facility, we talked about that. Joint commission, big check there. All right, very low complications rates. All right, check. Accessible, I'm everywhere. You can reach me on Facebook, on Messenger, on Instagram, on Clara. I don't know. The only thing you probably can't reach me is in my personal cell phone number. I'm not going to give that away, all right? But you have 10 other ways of reaching me, all right? So very accessible, and I'm all about communication. Communication is key. And of course, the Pure team. The Pure team is just awesome. I love the team. We all work really hard. We have a good attitude, positive vibes. We're always there for you, for our patients. And of course, Miquel and I, the CEO, we always, try to choose people that we know are just going to continue to lift the team up. All right. One of the things, one of my mentors always said that, who is an A leader. So an A leader is someone who chooses A+ team. Okay. A B leader, they don't want to be outshined by their team, so they'll choose C people so they don't get outshined. But an A leader wants the team to outshine them. They choose A+ people, and that's what we do here at Pure. So we got the A team. All right. But there's one thing which I think is not important. I would say it's actually of minimal importance. But unfortunately, it's something that people look at a lot. What do y'all think that is? Yeah? Are we gonna get any guesses? What is the least important thing? The last consideration. Okay?
Let's give you a few seconds to see somebody guess.
Somebody's gonna guess?
I think so.
3,
Content.
2,
The content.
1. No.
The price.
Price. Least important consideration. Okay?
For 5 people.
Excellent. Yes, that is exactly correct. The price should be probably the last thing that you're looking at. Okay? All right? You're not going to go to someone that's not safe because of price. You're not going to go to a facility that's not certified because of price. Okay? You're not going to go to someone who has no experience in what you're wanting to get done because of price. Okay? You're just going to suffer the consequences. Okay? You're going to get a poor outcome. You're going to get a high complication. You're going to have to come back to get things fixed, etc., etc. So price should not be in basically in the list of things that you need to do in order to choose the best surgeon for you. Okay? All right. A lot of talking.
And a lot of questions.
Good. All right. Well, let's go for it.
Okay, wait. Like short answers because there are so many questions. First of all, you have 1,000 of likes at TikTok. This is a record for us.
Excellent. I love our TikTok community. Getting more and more involved with us with every hump day. Remember, and we're here every single Wednesday, and we're going to talk about a whole bunch of different plastic surgery topics. I love educating our patients and our followers.
Okay, and this is for our TikTok followers because they don't know you yet. So do you do mommy makeovers and tummy tuck too?
So with the mommy makeover, it does include a tummy tuck. Okay, so the mommy makeover typically includes a breast surgery and the tummy tuck. So in terms of the breast, it could be whatever the patient needs: a breast aug, breast lift, plus or minus implant, or a breast reduction. And we do combine that then with a tummy tuck. Along with that tummy tuck, you get your muscle repair and liposuction to the flanks and the waist.
Can you still get a BBL if you have spider veins on the legs?
Typically, yes, you can. So spider veins are like the little tiny veins, okay? And it's not necessarily, something that makes you think that the patients had like problems with blood clots and stuff like that, which those are typically in the larger, deep veins, okay? So if you just have spider veins, but the rest of your circulation, your deep circulation is okay, then that's usually not an issue and that you're able to get the surgery. But of course, we are like we do for all our patients, we're gonna ask for a medical clearance and make sure that your primary care doc says that you're A-okay to proceed.
Okay, YouTube's waking up. How can fibrosis be treated at home?
All right, so when you like everything, the first thing you should do is try to prevent fibrosis, right? So there's some surgeon-related factors and some patient-related factors. So from the surgeon can't leave you too thin. You gotta leave about 1 centimeter of fat underneath the skin, and that greatly diminishes the chance of fibrosis, okay? Then the patient has to be very compliant with their post-op care. So you have to do your compression and your massage. Massage is incredibly important. You need about 20 lymphatic massages at least after Lipo360 or BBL to minimize that risk of fibrosis. If you start to notice some fibrosis, then there are some non-surgical modalities that you should employ first, and you can do things, and typically your massage therapist can take care of it. So these are like ultrasound therapies, carboxy therapy is one, and then also what's called wood therapy, okay? And continued massage as well. And if it's been a year and you still have the fibrosis, so at that point in time, a lot of times you need to go back to surgery, where we then do surgery to kind of break up and smooth out the fibrosis and kind of reset the body once again.
Okay, can I get a BBL if I got migraine?
If you have migraines, then yes. Typically the answer is yes. Once again, we're going to get that medical clearance from a primary care doctor. And the one thing you need to know, because a lot of migraine medications have aspirin in it, and you're not going to be able to take aspirin for a week before surgery to a week after surgery, okay? If you're taking some of the other medications like sumatriptan and other things, those typically are okay, but definitely no aspirin around surgery.
For bariatric sleeve patients, do you recommend BBL before tummy tuck?
I usually recommend it the other way around. Okay, so if you had massive weight loss, a lot of times you're going to have quite a significant amount of loose skin. And so the best thing to do is to tighten up that skin envelope first before you do the liposuction. So I typically recommend doing the tummy tuck first and then coming back 3 to 4 months later, and then we'll be able to do your BBL. Don't worry about the skin getting loose again. I've never seen that. Okay, so it's definitely the best way to do it is do the tummy tuck and then the BBL.
Okay, what's the highest BMI you'll accept to receive Lipo 360 and a BBL?
Right, so the highest BMI I accept is 30. So BMI has to be 30 or below. Okay? 30 or below, and that's part of our safety. Okay? Because many studies have demonstrated that patients that have a BMI higher than 30 have higher complication rates when undergoing surgery under general anesthesia. Complication rates for what? For respiratory issues, for wound healing issues, and also for blood clots, so your TBTs, your PEs.
Okay, the next one says, why some patients after a BBL lose their fat that was transferred? Is it dieting, or genetics?
So it could be a combination of all of the above. So first of all, when we do when we do a BBL, even if you do everything absolutely perfect, we're still going to lose a certain degree of fat. So it's quite common that we're going to lose about 30% of the fat that we transfer. Okay, and that's just baseline. All right. Then there are some other components, some genetic components and nutritional components that could potentially add to that, and also the patient behavior. So on the patient behavior side, if you're putting pressure, so if you're sitting, putting pressure in the buttock and hips in the first 6 weeks, that can increase the fat loss. All right, on the nutritional side, we ask all our patients to quote unquote feed the fat, increase the healthy fats in your diet. Good examples are like eggs and avocados and salmon and red meats, okay? But the goal is to be able to make sure that you maintain your preoperative weight or perhaps increase up to 5 pounds. So between operative weight plus 5 pounds, that's where you want to be. You don't want to go crazy. You don't want to increase 20 pounds. And you definitely don't want to be below your preoperative weight in order to get as much fat to survive as possible. All right, and then lastly, yes, there are some genetic components. So that's the part that neither the patient nor the surgeon can control. And some patients just absorb more fat than others.
Okay. If you have some skin laxity, are you eligible for a body tight?
Yeah, so that's a very good indication for body tight if you have mild skin laxity, okay? But you have moderate to severe, then you may need a skin excision surgery, such as a tummy tuck or an arm lift or a thigh lift, okay? But if you got mild to perhaps low moderate, then the body tight is a great asset that we can use to get that skin to tighten up. And we can do body tight on pretty much almost any part of the body. The common areas are the abdomen, the arms. It's great for the arms to avoid that arm lift scar. The thighs, another great place to use the body tight, and the chin. The chin, we've seen great results with the body tight to the chin. We call that face tight, but it's the same machine, just a smaller little transducer that we're using for that.
Okay, Doug, can I have prescribed Xanax before surgery?
Yes. So that's one of the medications that is okay, especially if it's been prescribed by your primary care doctor and it's something that you use as needed. Then certainly if you're having a little bit of the nerves acting up right before surgery, it's okay to take that Xanax. It's not going to really interfere with your anesthesia.
How can I get a consultation?
All right, great question. So the easiest and best way to get a consultation is to go to our website. So it's www.pureplasticsurgery.com, and right there, as you get into the website, you're going to see a button that says Virtual Consultation. You're going to hit that button, and then that's the way to get started. There's going to be a questionnaire. It's going to prompt you to send 3 photos. All right, make sure you fill out every single part of the questionnaire, put in the photos, and that's going to come to our coordinators, and then they're going to give you a call. Okay, here's a couple of hints that I want to give you as well. If you're looking for more than one procedure and you're not able to do that on the questionnaire, it's okay. Don't worry about it. Just put in one of them. Just make sure the information gets to us, and then when our coordinator calls you, they'll be able to adjust anything that you need adjusted. Okay, that's the best way and the easiest way to do it. We can start off with that virtual consult. Even if you're looking for an in-house consult or a video consult, which we can do as well. The easiest way, again, is to start with that virtual consult on the website, have our coordinator call you, and then they can set up appointments for video consults, in-house consults, or anything else that you need. But that way, you'll be in our system and they'll have your contact information.
When should I start taking my iron supplements?
All right, so once you have a surgical date, our preoperative team, they're going to give you a call approximately 45 days before surgery. All right, and they're going to explain the iron supplements as well as the vitamin C and folic acid, and that's when you're going to start taking them. Okay, so approximately 30 to 45 days before surgery.
Okay. Any advice or words for upcoming patient, me, who are very nervous and anxious?
Yeah, so first of all, especially if you're about to have surgery, especially if you're coming from out of town, it can certainly be a kind of a nerve-wracking experience. Okay, and we totally understand that. And so a lot of the anxiety though comes from just not knowing what's going on, not knowing what's going to happen. That's where this becomes super important, accessibility and communication, especially with the team. And that's why I spend so much time here with the lives, a lot of education on our Instagram, more education in the Facebook group. And so as you learn more about the process, as you see more videos, you know what to expect, those nerves start to calm down, okay? The other thing that works really, really well is, getting the stories and the support from the community, from other patients that have had surgery with us here at Pure. And for that, I highly recommend going to our Facebook group. So you go to Earl's Pros Community, and you notice the name there. It's not Earl's Pros Dolls. It's not Earl's Pros whatever. It's community because it's really that is truly what it's all about. There you're gonna run into thousands of patients that have surgery with us. You're gonna run into what we call the vets, those that have had surgery a few years ago. Some have had multiple surgeries, multiple rounds, and they're going to be able to give you a ton of information. And then you're going to be feeling a lot more comfortable with everything when you come here and it's all of a sudden surgery day.
The $1 million question.
Uh-oh.
You know what it is?
Yeah.
Tummy tuck plus BBL? Can you do that?
No. Yes. So it's a very, very common question. I think we get it probably with every live. And so there's a few things why we don't combine the tummy tuck with the BBL, especially with us here at Pure here in South Florida. So first reason. In South Florida, when you're doing a tummy tuck, you're limited to removal of only 1,000 cc's of fat via liposuction. That is not a lot of fat we're able to remove, so that's why we typically only focus it in the flanks and the waist. But it's not a lot of fat removal, and it's not a lot to be able to place into the buttock area. Okay, so it's typically not worth it. So that's number one. You're not getting bang for your buck. Number two, recovery becomes extremely tough, right? Because for the tummy tuck, you have to be, face up. And for the BBL, theoretically, you should be face down, not putting pressure on the buttock or hips. So then how are you going to balance that recovery? It makes it really, really tough. A lot of times you're using like these blow-ups and other things to try to minimize the pressure on the buttock and hips, but you're always going to be putting some degree of pressure to the area. By definition, perhaps you're going to lose more fat than you would otherwise. Okay? So very, very tough recovery as well. And then lastly, and probably most importantly, anytime you combine two big procedures like a tummy tuck and a BBL, the risks go up, complications rates go up. For example, complication rates of needing blood transfusions. That's significantly higher when you combine those two. Also complication rates with wound healing and infection.
Okay, the question says, do you perform abdominal marking, abdominal editing in the BBL procedure?
We certainly can add that for the right patient, for the right candidate. So we can do abdominal etching, we can do what we call HC or high definition lipo, and certainly we can do that at the time of a BBL. Now, it's not for all patients, all right? You gotta have certain criteria. Typically, the patient needs to be on the younger side. The BMI needs to be on the lower side, so typically 24 or less. And the skin quality needs to be good. You have to have good skin quality in order to qualify for a high definition type lipo. All right, everybody. All right, that was great. That was awesome. A lot of great questions here today. I love the enthusiasm. I hope this was very, very helpful. Make sure you have all the categories. Make sure the surgeons that you go to check all those categories so that you can have a beautiful long-term outcome. All right? Well, I look forward to catching everybody next Wednesday on Hump Day with Dr. Alex Earl. Take care. Ciao.